Hi everyone, welcome back to my page. My name is Dr. Kiroka Bridget. I'm a consultant obstetrician gynecologist. I discuss everything about women, children's health, and men's health sometimes on my channel. Please, if you have not subscribed to my YouTube page, subscribe now at OBGYN Talks with Dr. Adazion. Follow me on Facebook page at OBGYN Talks with Dr. Adazion. I'm also on TikTok and on Instagram with the same name. I have something in my hand here. Last time we discussed about contraception, and I promised I'm going to take each of them one after the other. So today I'm going to be taking combined oral contraceptive pills. That's the one that is swallowed. If you look very well, you are seeing the contraceptive pills. This is combined oral contraceptive pills. It contains progesterone and estrogen. Progesterone and estrogen are actually the hormones of the body. They are the hormones that helps ovulation, pregnancy, and all those menses and all those whatnots. They are present in the body. So these are synthetic form of those drugs and of those hormones. And this one actually contains levonorgestrel, which is progesterone, and ethinyl estradiol, which is estrogen. Then with these red tablets, these ones are iron tablet, that is ferrous. They are iron tablets. So this is a form of contraception, is a type of contraception, and it works by preventing ovulation. What happens is that the estrogen component of this drug works in the brain to prevent the production of follicle stimulating hormone. That follicle stimulating hormone is what causes the follicles, that is the egg, to mature and grow. So it stops the production of follicle stimulating hormone working in the pituitary gland. The pituitary gland is in the brain, and we've discussed that in our previous video. It's in the brain. So it will work by preventing that production of follicle stimulating hormone, and the progesterone component of this drug will now stop what we call luteinizing hormone surge. That luteinizing hormone surge is what causes ovulation. So it helps that luteinizing hormone surge cause ovulation. Why? So when you take this drug, it prevents both follicle stimulating hormone production and luteinizing hormone surge, and the person will not ovulate. So its action is by inhibiting ovulation. That is the action. Another method it works is by tickling the cervical mucus, making it impermeable for the sperm to migrate. So even if the person had intercourse, the sperm may not be able to migrate to go and fertilize an egg if an egg has already been released. And it works by if the person that is taking it takes it judiciously. It's not something you take anytime you want. So this is the method, the mode of action for this. Its advantages is that when you start taking it and you stop, you want to get pregnant, fertility returns promptly. So it does not take time for your fertility to return. It also helps to lessen blood loss. Then we also use this to do other things, like if we are having irregular period, we can use this to control it, depending on what we found as the cause of that irregular period. So those are the advantages of this. It's taking every day. It has an arrow. If you look at it, it has an arrow. I don't know if this camera can pick it very well. It has an arrow. You take from day one. It has a day one. You start from here. You take first every day. It's taking every day, and if it's possible, take it at a particular time of the day. If you prefer to take it, for assuming in the morning by 8 o'clock, just wake up, your alarm rings, you know that this is the drug you're about to take. You take it every day for 28 days. You take this every single day for 28 days. You stop at the white one and you now start taking this red one, which are iron. As you've reached here, because remember I said that normal cycle is between 21 to 35 days. So when you reach 21 days, we expect that your body start preparing to cause menses. Now, there are other things that could happen if you miss taking your drugs, and that will be the next thing I'm going to talk about. If you have not subscribed to my page, please subscribe just now at OBGYN Talks with Dr. Adazion. Follow me on Facebook page, also TikTok, Instagram with the same name. Thank you. Now, when you start taking this drug, and this is the first week, the first line is the first week, the second line is the second week, the third is the third week, and the fourth is the fourth week. If you start taking this drug and you miss one or two tablets, we encourage you that immediately you remember. Let's assume you missed one tablet within 24 hours. You missed today. Immediately you remember, please go back and take that one and continue taking your pills. And if you miss two tablets, let's assume you missed yesterday and you remember this morning, you're supposed to take it yesterday evening, and you remember this morning that you did not take yesterday. Please go back, take that one you missed, immediately you remembered it. Let's assume you remembered in the morning, take it immediately you remembered it. Even if you miss taking two pills in a day, so you can still take in the morning and take the time you are supposed to take the second dose. That is, you are supposed to take in the evening of yesterday, you forgot. You have to take that pill you forgot in the morning and then take the one of today in the evening. So even if you miss taking about two pills in a day, go on to take your pills and continue taking your pills. Now, if you miss more than two of this, immediately you remember, take the one, that pill you remembered immediately, and continue your pills. However, it is encouraged that you go on another form of contraception, for example, barrier method. You go on barrier method and continue taking it for 7 days. Let's assume that you missed two pills. You missed day before yesterday and you missed yesterday and you remember today. Please take your pills immediately today. Now continue the pills and go on another form of contraception. For example, barrier method, start using condom for the next 7 days and continue taking your pills. Now, if you miss taking your pills on the last day, on this last day, then take the one you remembered immediately, go on a barrier method and forget this placebo. Forget taking them, continue the other pill, even if you miss that you did not ovulate. Now, at some point, you have to do a pregnancy test. So this is the way to take this pill, and peradventure you forget any of them. You take it this way. It has advantages. One of the advantages is that it helps prevent mid-cycle pain. It helps prevent dysmenorrhea. Dysmenorrhea means painful menses. It will help prevent those that are having menses. We use it to regularize menses. It prevents rheumatoid arthritis. In fact, any form of thing that is associated, that is cycle dependent, this will prevent it. It also helps in preventing ovarian cancer, helps in preventing endometrial cancer, but it has disadvantages. We do not encourage someone that has had stroke to take this. Someone that has heart disease, we do not encourage you to take this. Someone that is at risk of myocardial infarction, you should not take combined oral contraceptive pills. Someone that is at risk of embolism, deep venous embolism, deep venous thrombosis, you should not take these pills. It has also other disadvantages, and for someone that is at risk of breast cancer should not take this pill because it can lead to breast cancer for those that are at risk. It can increase the risk of cervical cancer. That's the one thing with this. So thank you for watching to this point. This is about combined oral contraceptive pills. If you have any question or comment, you can drop it on the comment box. Help me to share this video. Help me to like and watch to the end. Thank you. Hit the notification button for more because I'm going to discuss other forms of contraception and what to do. Thank you.